You are watching Radicon. Okay, we are still discussing mechanism of biological damage after types of exposure and mechanism of molecular and cellular damage. The next topic is dose response curve. Different types of health effects can show different curves. First, on the left is a sigmoid curve. It shows high dose at higher dose rate with a threshold model before visible effect. This type of curve shows a safe level of radiation below the threshold level where no effects are expected. This is example of deterministic effects such as hair loss, cataract, and skin injury. Amount of radiation after which 1% of exposed population can develop a certain symptom, the said dose is considered to be the threshold dose. Second type of the curve on the right side is linear. Mostly shows lower dose at lower dose rate and does not assume safe levels. Such dose effect is observed in stochastic effects such as cancer, leukemia, and hereditary effects. In radiological protection, it is assumed that there is no threshold dose for stochastic effects. Under this assumption, the radiation exposure, even at low doses, may exert some effects. Epidemiologically, it is very difficult to detect stochastic effects due to radiation exposure at low doses below the range of 100 to 200 millisieverts. But the ICRP specifies the standards for radiological protection for low dose exposure, assuming that the effects would appear depending on the dose levels as a linear dose response. A very important aspect of radiation protection is radiosensitivity, which means different types of cells and tissues respond and react differently to radiation. Actively dividing cells that are less differentiated tend to show higher radiosensitivity. For example, hematopoietic stem cells in bone marrow are differentiated into various blood cells while dividing actively. The new, immature, or undifferentiated cells are highly sensitive to radiation and can die due to a smaller amount of radiation. In addition, the epithelium of a digestive tract is constantly metabolized and is also highly sensitive to radiation. Likewise, testicular and ovarian tissues are more radiosensitive than adult mature tissues such as bones, muscles, and nerves. For the same type of tissues, certain factors can affect radiosensitivity. Physical factors such as higher linear energy transfer, dose rate, and chemical factors such as oxygenations and drugs can influence radiosensitivity. As discussed in the previous slide, certain biological effects such as mitosis and cellular injury can also have an impact on radiosensitivity. Whole body exposure to radiation exceeding 1 gray at one time causes disorders in various organs and tissues. This series of disorders in multiple organs is called acute radiation syndrome. The prodromal symptoms appear within 48 hours after the exposure and depend on the radiation dose. Exposure to radiation exceeding 1 gray may cause loss of appetite, nausea, and vomiting, while exposure to radiation exceeding 4 gray may cause headache, etc. When exposure dose exceeds 6 gray, symptoms such as diarrhea and fever may appear. Following the prodromal phase, the incubation phase may last any time up to 3 weeks. In general, the larger an exposure dose, the shorter the incubation phase. Then, in the onset phase, disorders appear in the hematopoietic organs, GI tract, nerves, blood vessels, in this order as the dose increases, with the last stage of convalescence or death. Lethal dose 50-30 is the dose which would cause death to 50% of population in 30 days. Its value is about 2 to 3 gray for humans for whole body radiation. Lethal dose is generally described as percentage of population first following the number of days. That concludes our discussion of the effects of radiation at cellular and molecular levels. We reviewed exposure mode, mechanism of injury, dose response curves, radiosensitivity, acute radiation syndrome, and concept of lethal dose.
This video is presented in collaboration with Radicon Institute of Radiology. You are welcome to subscribe to our YouTube channel and click on the notification bell for updates. For more modules in Radiology CMEs, please visit our website www.radicon.org.